Hello, everyone, and welcome back to the blog. Today, I want to talk about the important role our diagnostic imaging team plays in the lives of all Albertans. This team does fantastic work, performing more than 2.9 million exams every year at 130 facilities across Alberta. They are also projected to complete nearly 486,000 CT scans this year, an increase of 58,000 from last year. However, we've heard from Albertans is that the wait time to access diagnostic services like MRIs and CT scans are too long. We know how important it is for patients to receive timely access to these services and to get their test results as quickly as possible. We take all patient concerns very seriously and are working to improve this very important service. This can be challenging as our population continues to grow and demands on our healthcare system increase, but I am confident we will rise to this challenge as the diagnostic imaging team has developed a CT and MRI implementation plan. The plan will focus on minimizing wait times, decreasing costs, and better managing the demand for these services. Joining me to talk more about this plan and the work our DI team are doing are Dr. Mark Joffe, Vice President and Medical Director, Cancer Care Alberta and Clinical Support Services and Provincial Clinical Excellence, and Mauro, Vice President, Cancer Care Alberta and Clinical Support Services. So Mark, I'm going to start with you. Can you highlight some of the great work that diagnostic imaging is doing?
As a clinician, you know just how important diagnostic imaging is to the clinical care that we provide to patients. It's so absolutely vital to everything that we do in modern healthcare, from that initial image that might be taken in the community or in one of our clinics or an emergency department that helps us to make an initial diagnosis, or to the other specialized imaging that might be needed to help plan treatment, or to the interventional procedures that increasingly actually help us to avoid surgery in some situations, to, of course, all that follow-up imaging that's so critical to track the response to treatment. In so many ways, and really with so many different types of imaging, it's just so critical to everything that we do in modern healthcare. During COVID-19, imaging has been incredibly important. I would say that in the early part of the pandemic, of course, our activity was down, as it was in many sectors across the system. But then we rebounded. We began looking at different strategies for getting patients in. And really within a couple of months, our activity levels increased. And in fact, overall, we've actually had higher volumes over the last few months than we did last year.
Mauro, before I get to your question, I just want to make sure that people understand that you're actually not wearing a Toronto Maple Leafs jersey, but that you're wearing the AHS jersey, just because the colors are confusing. So Mauro, moving on to you, can you expand on some of the challenges involved in increasing access and reducing wait times?
Thanks for that, Verna. And yeah, thank you for clarifying, because the last jersey I would ever put on in my life is the Leafs jersey. No disrespect. Anyway, there are several factors that are contributing to the challenges of increasing wait times and access in imaging. Some of it I call organic growth, which stems from things like aging population and just the general growth of the population within Alberta. We're also seeing a lot of increases in chronic conditions such as cancer. And so it's putting a strain on the use of imaging resources, particularly cross-sectional imaging such as CT and MRI. But with the evolving technology, we're in a way our own worst enemy, because imaging has become so reliable and so fast with reporting of results in this province that the demand has started to increase for it. The technology, the quality of the imaging, the speed of the imaging has become kind of a main staple in diagnosis for patients. And so demand has increased. You do a better job and you provide better imaging and faster and timeliness to results, and the demand ultimately goes up. As well, we have a lot of subspecialty branches in Alberta with our very highly skilled radiologists, and then the need to start to dive down into a lot of the specific diagnoses or specific chronic ailments. We've got a lot of radiologists that have the subspecialties to take on some of those. And then I would obviously be remiss not to mention COVID. The early onset of COVID had a lot of people staying away from their appointments. We saw a drop in imaging, as Dr. Joffe had indicated. And now we're seeing a latent demand build up, and we're doing very well. We've caught up and we've actually surpassed our our 2019 volumes, which is great, but that bolus of imaging was a bit of a challenge as well.
Thanks, Mauro. Mark, following up on that, can you tell us about the implementation plan and how it plans to address some of the challenges?
Sure, thanks. As you highlighted earlier, Verna, we do a lot of imaging in this province. The implementation plan is really focused primarily on CT, MR exams. So we do, this year, we'll be doing something like 486,000 CT exams and somewhere in the neighborhood of 220,000 MR exams. Now, despite that, I should actually mention that we actually have some of the lowest utilization rates for CT and MR in the country, but it is growing. It's growing at about 5% per year for CT and about 3.5% for MR examinations. And we can't just keep doing more and more and more. In order to be sure that our wait times are acceptable, we have to look at what we're doing, how we're doing it, how we might be able to do it better, and ultimately how to be sure that our system will be sustainable. Now, ideally, our system should support clinicians in choosing optimal imaging from the outset. And perhaps in some situations, that's actually no imaging at all. And then, of course, we need to be sure that patients will receive their imaging within an appropriate time frame. Now, the AHS review identified a few ways for us to look at efficiencies, to find some savings within the system, and we are exploring those. We do need to optimize our workforce and how we use our equipment. We're currently in discussions with our radiologists about the future of service delivery. And ultimately, we do need to find savings within the system and then reinvest those savings in the system to reduce wait times and to ensure that we will be sustainable into the future. We need to look at how we manage the demand on the system by carefully looking at what we're doing it, again, how we're doing it, and constantly looking at ways to improve. Through Right Care Alberta, we're going to help to identify some initiatives that may improve how we use imaging, focusing on appropriateness of imaging. And I'd really like to emphasize that we have advocated on behalf of patients, staff, and physicians, and we know that there will be funding committed to this implementation plan so that Albertans will not have to wait longer than is clinically appropriate.
So Mauro, I think there's a big question around, the impact that Connect Care will have on diagnostic imaging. So can you maybe describe that a bit more?
Yeah, for sure. Thanks, Verna. One of the things that I think sticks out the most in talking to the staff is the implementation of a thing called CDS, Clinical Decision Support. And what we've seen already at the sites that have implemented Connect Care is a reduction in duplicate exams, which is awesome. So there's two factors that are contributing to that. One of the factors is that with the CDS, if a physician orders an imaging exam and there's a prior one booked within the last 24 hours, I believe, it'll alert the physician that there has been. And then the second component is the very large, kind of what I would call longitudinal record of imaging within Connect Care allows physicians to have a very broad spectrum of all the imaging that's been conducted on the patient. And so the outcomes on that have already been really good for the small number of sites that we've implemented Connect Care, because in 2 quarters, we've reduced by approximately 3,000 exams. We've avoided 3,000 duplicate orders of exams, which is absolutely fabulous.
Perfect. Thanks very much, Mauro. And I have a final question for both of you. What do you think the future of diagnostic imaging looks like? So Mark, I'm going to start with you.
Well, Verna, I'm not a Toronto Maple Leafs fan, but I am a Yogi Berra fan. And of course, Yogi Berra said it's tough to make predictions, especially about the future. So despite that, I'll give it a bit of a try here. So, obviously there will be new technologies coming. I think some of this is really on the near horizon. Some of the routine work that we do today is going to be improved and will be made more efficient through the use of artificial intelligence. We are absolutely going to rely on our radiologists and our diagnostic imaging teams to help us implement these new technologies and understand where and how they should be used. I think there will be increasing focus on appropriateness, trying to be sure that Albertans get the right test at the right time. Of course, sometimes that will mean that no test or no imaging is necessary. And I hope that, and I believe that our physicians are going to start to receive timely reporting so that they will know how they're using imaging and technologies and tests in comparison with their peers.
Great. And Mauro, what's in your crystal ball?
I think my diet partner stole most of it. All at the risk of sounding a bit redundant, I'll throw a couple things out. So one, there are probably three things that I would think. One is evolution in technology, just better image quality, faster machines. We've seen, how CT has evolved over the years, and the speed of these gantries and how they can capture still images of a beating heart are just amazing. And we're going to start to see really big evolution, I think, in that over time. The second one I think is going to be that gets overlooked is minimally invasive procedures. So our interventional suites are just a huge backbone to patient care, and it can avoid so many patients having to go to surgery versus being on a DI table and having a minimally invasive procedure versus a full surgery. And we've already seen that happen, and I think that's going to continue to evolve over time. And then the third one I think Dr. Joffe had mentioned was artificial intelligence. And I think we're going to see these tools evolve over time that are going to be used in conjunction with our radiologists to improve accuracy of disease detection. So I think it'll become a staple and a tool that radiologists will work with over time, and we'll see it evolve in the coming years.
Perfect. Thanks very much for coming on today and educating us a bit about what's the art of the possible in diagnostic imaging, and especially in the needed investment we know into reducing the wait times. So look forward to hearing more about it in the future. I also want to thank everyone on the diagnostic imaging team for your work and continuing to provide quality care to Albertans. As you know, you are all a key part of the AHS teams. As you've heard last week, the number of vaccines available in Alberta has increased. And so just moving on to a different topic, because there's no week without talk about vaccines. All eligible healthcare workers in phase 1 who have received an email invitation are now able to book appointments for that vaccine, so please do so. These include those who had previously received their invitation but did not book an appointment. So really, please schedule your appointment. If you're unable to find the booking link you were sent, please call HealthLink. There's a new number that we're using that is only for vaccine calls, which is 1-888-851-1919. We thank everyone for the support of the AHS COVID immunization program as we work together to ensure that we keep each other and all Albertans safe and healthy in the months to come. Please visit the online booking tool FAQ for questions about the online booking process. There's also more information on COVID-19 and vaccine sequencing on the redesigned COVID-19 website. So thanks to all of you. Thanks again, Mark and Mauro, and we'll see everyone next week.
Together, we do amazing things every day.